สวัสดีค่ะ Welcome to Thailand, the land of smiles. Thailand is located at the heart of the ASEAN countries, which shares its borders with Myanmar, Laos PDR, Cambodia and Malaysia, and has an area of 513,115 square kilometers. Bangkok is its capital city. Thailand is a democratic country with the monarch as the head of the state. The Thai kings provided the Thai subjects with innumerable benefactions. Especially King Rama V, who built the first hospital for the mentally ill on November 1, 1889. Since then, more psychiatric hospitals were being built, which have been under the jurisdiction of the Mental Health Division, Department of Medical Services, Ministry of Public Health. In 1992, the Mental Health Division was upgraded to the Institute of Mental Health, and 2 years later changed its name to the Department of Mental Health and reports directly to the Ministry of Public Health, being one of the 9 departments of the ministry. The Department of Mental Health has 18 psychiatric hospitals and institutes spread out all over the country to provide treatment and rehabilitation for psychiatric patients, both outpatients and inpatients, as well as provide telephone counseling services and training courses on mental health and psychiatry. It also provides mobile units in the community to visit patients and provide psychosocial support to disaster victims or other emergency cases. In addition to the psychiatric hospitals and institutes, there are 14 other mental health centers. Their main responsibilities are to promote mental health and prevent mental health problems of the people. The Department of Mental Health does not work in isolation, but integrate mental health tasks with the country's public health services system. At present, every community hospital at the district level has psychiatric nurses, which enable psychiatric patients to receive treatment at the hospital close to their home. Psychiatric patients can also use the services at university hospitals, hospitals at the Defense and Interior Ministries, and a private psychiatric hospital. The Department of Mental Health also cooperates with agencies in the public sector other than the Ministry of Public Health, such as the Ministry of Education, Ministry of Social Development and Human Security, Ministry of Interior, Foreign Ministry, and the private sector, such as monks, radio disc jockeys, housewives groups, private foundations, etc., so that mental health work can reach all the target group, both locally and internationally. The Department of Mental Health outstanding projects comprise the To Be Number 1 project. Princess Ubonrat is the chairperson of this project, with the objectives to change the values, imbue the conscience, and provide immunity to teenagers and youth to distance themselves from drugs. Its motto is, to be number 1 without relying on drugs. The Thai Children Intelligence Development Project, by conducting a survey of the students' intelligence and develop technical knowledge as well as various medias. Mental Health Crisis Institution Project. The Department of Mental Health established Mental Health Crisis Centers, or MCC, in psychiatric hospitals and institutes to provide timely assistance to disaster victims, which is a way to prevent mental health problems that may follow suit. The Mental Health Information Line through telephone number 1667. Those interested to obtain mental health information may dial 1667 for information 24 hours a day, free of charge. The Mental Health Counseling Line number 1323. For those requiring counseling, The service is for 24 hours a day, free of charge as well. The Depression Care for Depressive People and Suicide Prevention Project. By screening the risk group, then providing correct and appropriate remedy to reduce the suicidal rate among the Thai people efficiently. The Mental Health Gap Intervention Project. By surveying and screening psychiatric patients in the community in all areas of the country in order for them to receive treatment and rehabilitation. The Happiness Promotion Among Thai People Project. Through evaluating the happiness of Thai people in every province of the country, so that each province has its own information to use in developing projects to create their own happiness. The Department of Mental Health provides technical knowledge and various learning media support. The annual National Mental Health Week campaign, from 1st to 7th November annually, to provide knowledge and raise awareness of the importance in looking after one's own mental health, that of the family and the society, which is to promote mental health and prevent its problems. Mental Health Services Quality Development. The Department of Mental Health has been accredited with the ISO 9001-2008 and has been able to continually maintain the standard. The Department of Mental Health places high importance in developing its relationship with overseas organizations through international mental health cooperation. There are exchange visits between the Thai and foreign executives and academicians to exchange technical knowledge and foster good relationships. Each year, the Department of Mental Health organizes the annual International Mental Health Conference with over 100 foreign participants. For the ASEAN mental health work, the Department of Mental Health was the core in setting up the ASEAN Mental Health Task Force, or AMT. The first AMT chairperson was Dr. Apichai Mongkol, who was then the Director General of the Department of Mental Health. Furthermore, the Department of Mental Health receives the honor of being the coordinating office of ASEAN Mental Health Task Force. Although the Thai mental health tasks are myriad, it has one single objective, and that is for the Thai people to have good mental health and happiness, and to share such happiness with our neighbors, the ASEAN countries, and other countries in every region around the world. สวัสดีค่ะ